What's an MCL?
Maximum contaminant level.
That's
Yeah.
the enforcement,
Okay.
that's the enforcement.
That's the
standard.
enforcement standard.
The maximum contaminant level goal is the toxicologically based number that is purely based on science. It's not enforceable. But that's the MCL is supposed to be set by law as close to the MCLG as possible. That's where you get into economics and politics and technological feasibility.
Do you have a question?
I did. My question goes back to the soil, because I know you didn't do the chart for the soil, and if you're inhaling, I think you said like 100 milligrams a day, and 20% of that soil that you inhale is available for absorption into the bloodstream. So if you, let's say, lived in Centennial Hall on American University's campus near the Child Development Center, and were inhaling 100 milligrams a day of the dirt with the elevated arsenic levels in that area, is there an elevated chance of risk of cancer based off of that to a significant extent?
It would have been, based on the numbers that I generated here, showing that that 40 ppm dirt was 3% of the RFD.
Mm-hmm.
If you were 10 times, if the arsenic levels were 10 times as high, say 400 ppm,
Mm-hmm.
You would have been at 30% of the RFD.
Mm-hmm.
And at the RFD, the risk was 5 in 10,000.
Okay.
So it would still be less than that. It'd be probably in the range of 1 or 2 per 10,000.
Okay.
There'd be some elevated risk. You don't want to breathe arsenic.
not on my to-do list for my morning.
There's no doubt about it. The scientific goal is 0.
I just wanted to say that I was reading Richard Albright's book recently on Spring Valley. Albright was the person at the DC Department of the Environment who, in essence, pressed and eventually forced the Army to remain here to do cleanup. But he was talking about at the Child Development Center, apparently they were growing veggies on the arsenic soil, and then the children had as a play area the dirt-covered arsenic soil. So when you think that they're not, what, 70 kilos or
Yeah,
they're quite a bit smaller,
10 or 15 kilos on the outside.
and their risk would have, I gather, been, I hadn't put that together with,
Sort of. Those risk numbers are based on lifetime average daily doses,
okay.
so you have to average that out over a lifetime, but then you got to get into, are the younger organisms more susceptible to this effect?
and they're not, and they're getting a much larger dose than you would expect.
Yes,
than you would
on
expect.
a per kilogram basis. Because there are also a lot more hand-to-mouth stuff, and they're probably taking in more than 100 more.
I just want to give Ms. Resnick the opportunity to introduce herself as well, and there's a short slide again. Yeah.
Okay.
Ms. Resnick was involved in the Johns Hopkins study that was done, and she'll talk about that.
And I think we covered some of the areas that you guys are asking questions about. But first up, Michael, I want to say when my senior year of college, in March, I was eating Doritos and watching college basketball. So I'm really impressed that you put this all together. You probably didn't watch much basketball in March because you were busy doing all the background work. So I'm very impressed. So I'm Beth Resnick. I'm with the Johns Hopkins Bloomberg School of Public Health. And the other thing I'm impressed about is not only your work, but how many young people you have here. And I'm guessing most of you are students at American University. And I will confess, I sat here and I looked out and I thought, wow, when I tell you about our study, we did a lot of outreach, but we really didn't outreach to the university community. We did more the residents. So if we do move forward, which I'll talk to you about, that would be something we really want to do. Right.